Imagine being diagnosed with colorectal cancer only to find out that a simple, low-dose aspirin regimen could significantly reduce the risk of recurrence. This groundbreaking discovery has sent shockwaves through the medical community, and for good reason. A Swedish-led research team at Karolinska Institutet and Karolinska University Hospital has made a remarkable breakthrough, showing that a low dose of aspirin can halve the risk of recurrence after surgery in patients with colon and rectal cancer who have a specific genetic mutation. But here's the astonishing part. This mutation is found in approximately 40% of patients, which means that thousands of people worldwide could benefit from this treatment. Every year, nearly 2 million people are diagnosed with colorectal cancer, and between 20 and 40% of them develop metastases, making the disease more difficult to treat and more deadly. Previous observational studies had suggested that aspirin might reduce the risk of certain cancers and possibly even the risk of recurrence after surgery in patients with colorectal cancer, but these findings were inconsistent and lacked concrete evidence. That was until the ALASCCA trial was initiated, which has now been published in the New England Journal of Medicine. The study included over 3,500 patients with colon and rectal cancer from 33 hospitals in Sweden, Norway, Denmark, and Finland. Patients whose tumors showed a specific genetic mutation in the PIK3 signaling pathway were randomized to receive either 160 milligrams of aspirin daily or a placebo for 3 years after surgery. And this is the part that's got everyone talking. For patients with the genetic mutation in PIK3, the risk of recurrence was reduced by a staggering 55% in those who received aspirin compared to the placebo group. But how does aspirin work its magic? The researchers believe that the effect is likely due to aspirin acting through several parallel mechanisms, including reducing inflammation, inhibiting platelet function, and tumor growth. This combination creates an environment that's less favorable for cancer to thrive. As Ganna Martling, professor at the Department of Molecular Medicine and Surgery, Karolinska Institutet, and senior consultant surgeon at Karolinska University Hospital, puts it, aspirin is being tested here in a completely new context as a precision medicine treatment. This is a clear example of how we can use genetic information to personalize treatment and at the same time save both resources and suffering. But here's where it's controversial. While the results are undeniably impressive, some might argue that the study's findings are too good to be true, or that the treatment might not be effective for all patients. And this is the part most people miss. The fact that aspirin is a well-established, readily available, and extremely inexpensive drug compared to many modern cancer treatments. As Anna Martling notes, aspirin is a drug that is readily available globally and extremely inexpensive compared to many modern cancer drugs, which is very positive. The study's results could have global significance, influencing treatment guidelines for colon and rectal cancer worldwide. So, what do you think? Should aspirin be considered a standard treatment for patients with colorectal cancer and the PIK3 genetic mutation? Share your thoughts in the comments below. The study was funded in part by the Swedish Research Council and the Swedish Cancer Society, and the findings have been published in the New England Journal of Medicine. As we continue to unravel the mysteries of cancer treatment, one thing is clear. This breakthrough has the potential to change lives. But we want to hear from you. What are your thoughts on this groundbreaking discovery? And how do you think it will impact the future of cancer treatment?